The Ministry of Health today has launched approaches of the use of digital tools in the COVID-19 response. This comes after the COVID-19 pandemic has impacted deployment of healthcare following the unprecedented surge of the virus variants. Sheila Ngetich with the details.
The surge in the COVID-19 cases in the country has negatively impacted the clinical response in the surveillance and patient management in Kenyan hospitals.
One of the things that we can be able to work on is interoperability of the data, jointly developing the development of the tools, so that we don't have bits and pieces, but we have a tool that encompasses everything and can be able to collect all the information.
With the pilot project being deployed in Machakos and Mombasa counties, Dr. Patrick Amoth, Director General of Health, states that this is a field with opportunities of improving the COVID-19 response better.
In terms of the documentation, some of the data was not correctly entered. Opportunities are immense.
Meanwhile, the Director General has urged Kenyans to embrace the mixing of vaccines as a way of containing the virus.
The fact that if you do that, there's a better immune response if you mix the vaccines. And with that information, they have scaled up to be able to do it. WHO has been hesitant on its side because they say the data is still limited, but because of the paucity in terms of supply of vaccines, it is something that we could also be able to explore.
Systematic recording of screening data and integration of digital tools, as recommended by the Ministry of Health, could provide an edge in the fight against COVID-19. Sheila Ngetich, Switch TV, Nairobi.